Hey everyone, it's Glenda here with Little Steps Asia, and we are live today at Prohealth Sports And Spinal Physiotherapy in Central Hong Kong. I'm joined by Maritza and by Christy, and they are going to be sharing their insights on how to best take care of our bodies during pre- and postnatal care. But before we get into formal introductions, a few quick reminders to everyone that's watching right now. We do go live every week, and you can see what's coming up on our Facebook page on the events calendar. Click on the ones that you're interested in, and we'll be sure to send you a reminder. As well, we have a weekly newsletter, and you can get connected with that in our description down below. We are in 6 different cities right across Asia, and as I mentioned before, we're in Hong Kong today, and we are live, which means that we love to interact with you. So please ask your questions, share your comments in the in the comment section down below, and we'll be sure to get to it before the hour is up. So a little bit more about what we're discussing today. Keeping our bodies in good working order is crucial as we embark on our pregnancy journey. And physiotherapy can play a big part in that, not only through our pregnancy, but also afterwards for issues such as pelvic floor dysfunction. So without further delay, we have Maritza here down at the end. She has more than 20 years experience in physiotherapy, and she specialized in women's health when she noticed the lack of the service here in Hong Kong. Her areas of expertise include pelvic floor sacrum pain, prenatal and postnatal pain, and finally pregnancy, Pilates, and incontinence. Thank you so much for being here.
Thank you.
As well, we have Christy, and she graduated from the UK and gained experience working in public hospitals and supporting sporting events. Her area of women's health focuses include pre- and postnatal health, pelvic health, and lactation problems. Thank you, Christy.
Thank you.
So before we get into the many questions that we have for you ladies, we will be breaking our conversation down into 3 topic areas today. The first one being prenatal physio, and then we'll get into preparing for delivery, and finally we'll wrap up with postnatal physio. So prenatal physio is what we'll start off with, and Maritza, I will direct this question towards you.
Sure.
How can women cope with changes in their body during pregnancy? Because there are so many, we know that.
That's right. So during pregnancy, you usually put on weight, so probably around 30 pounds or sometimes even more. During that time, it's best to watch what you're eating, not to overeat, and to stay active. I know a lot of Chinese culture says that because you're pregnant, you should eat for 2. That's not really true. You don't have to overeat. Because if you overeat, you're actually putting too much weight too soon. For staying active, it's best that you continue doing exercises, gentle exercises, just as, such as walking or swimming, and avoid strenuous exercises such as running or hiking. Besides putting on weight, you may try to overarch your back to compensate for the growing tummy. That will actually cause your back to overarch, and then you will walk differently. In order to correct that, you can try to stand against the wall and tilt your pelvis, which is this part, backwards to decrease the arch of your back. And also during pregnancy, there's some hormones that are released by your body to allow your joint to relax. During that time, it's best to avoid overstretching yourself. You should actually do more strengthening exercise such as reformer Pilates.
Wonderful.
Thank you.
Okay, and for Christy, what are some strategies to cope with carrying extra weight?
Mm-hmm. So some people experience pain during pregnancy because of the body change Maritza just mentioned to us, and also from the increasing weight of the baby. So usually gentle aerobic exercise, for example, brisk walking, stationary bike would be beneficial to us. Also, strengthening exercise, especially on the core, can actually help us to build some muscles around our body to cope with the increasing weight. There are also some other strategies to help us to cope with this. For example, when you have to change your position, for example, getting up from the bed or from the chair, you have to try to move slowly, or when you sneeze or cough, try to lean forward a little bit or brace your tummy. in order to cope with this. And also to maintain a correct posture. For example, when you're in sitting, try and sit up tall and straight and try to roll the shoulder back and pull your tummy in. And in addition to that, you can also try to wear a pelvic belt to try and stabilize your pelvis and try to reduce some low back pain.
Wonderful. And do you have any advice for women that haven't taken on exercise before they were pregnant?
For women who are less active, or a bit more sedentary, I will ask them to start with gentle stretches first, because if they haven't been active for such a long time, maybe their muscles are actually really tight. So they should actually start by stretching, proper stretching exercises, safe for pregnant women. And after that, then gentle strengthening exercises that can be used, a dumbbell or a TheraBand that are safe for pregnant women.
Wonderful. Thank you. And back and neck pain can be a problem for a lot of women. So what is a great way to combat that?
Yeah, when you're pregnant, because of the change of your body composition or the increase of the tummy being so big that you have to compensate for that, some pregnant women will have neck pain or back pain. And because of that, some therapeutic treatment are not allowed to do on pregnant women, but some can be done, such as a hot pack. You can use a hot pack to relax the muscles, stretches, or massage. A physiotherapist can assess the condition, which muscles are causing the problem, help to do deep friction massage or gentle massage, and then strengthen the core, because usually the core is too weak to hold on to the weight of the growing belly.
Okay. And then some ladies may be experiencing hip or pelvic pain before they actually become pregnant. So how would you suggest that they address that?
So pregnancy actually puts a lot of stress on our pelvis and the hip joint because of the ligament laxity and also the change in center of gravity as the baby grows. So it is often good to try and find a physiotherapist before pregnancy to try and address your hip pain and pelvic pain before getting into pregnant, to try to avoid it gets worse.
That makes sense. What would you say is the best sleeping posture to adopt during pregnancy?
So the best sleeping posture would be sleeping on your left side, and put a pillow in between your knees and ankles, and you can also put a small pillow to try and support your belly.
And why in particular your left side?
Because if you sleep on the left side, it improves the circulation, and there would be less compression as well.
Okay, well that takes us into our second topic area, which is preparing for delivery. So how can women prepare their bodies for childbirth? I'll direct that towards you, Maritza.
Alright, so in order to prepare your body for childbirth, I think it's very important to strengthen your core. So those are the muscles in front of you that's holding the pelvis. So there are 4 muscles here, so the rectus abdominalis, the obliques, and the transverse. So those muscles actually help you hold onto the growing belly, but it also helps prevent abdominal separation, so which is called diastasis rectus. In order to see if you actually have abdominal separation, you have to seek medical professionals such as a physical therapist, and they will assess you. And if you do have abdominal separation, I think one of the best way is to do reformer Pilates. The benefits of doing reformer Pilates while you're pregnant is to prevent back pain and neck pain, to prevent pelvis pain. If you already have back pain, neck pain, or pelvis pain, it can actually minimize it or actually cure the problem. It can optimize the quality of life while you're pregnant. It can help facilitate childbirth because you will be strong enough to be able to push during delivery. It can also minimize the chance of incontinence, and it can help prevent or minimize the abdominal separation. So I think reformer Pilates is one of the best treatment, or we should call exercise for pregnant women.
Sounds very beneficial. For pregnant women, how can they make themselves comfortable during the birthing process?
So during the birthing process, usually squatting is the most natural way, the less painful way. So either you could find a chair or a table that you can lean on it, put your hands on it and then squat, something stable, or you can use a fit ball and sit on it. While you're sitting, you can do pelvic tilts, forward, backward, sideways, and even circular motions, and also bounce on the fit ball, because both squatting and bouncing on the fit ball actually helps relax the pelvic floor and takes some of the pressure away and takes some of the pain away. So while you're getting ready to give birth, I think either those two positions will help.
Wonderful. And I'm sure there are a lot of birthing partners out there that would like an answer to this question. How can they make it more comfortable for the woman that they're assisting that's giving birth?
Mm-hmm. Okay, so first of all, the parents should do the preparation, for example, reading something or attending the prenatal classes together. But it is different for everyone, so it is good to often discuss among yourself, how would each other help during the birth process. So generally speaking, it is important for your birthing partner to provide physical and emotional support during the birth process. So some examples of physical support would be maybe just gentle massage, give her a hug, or maybe just hold her hands. And some emotional support would be positive words of encouragement or reassurance. For example, tell her how well she's doing or how much you love her. At the same time, you can also remind her of some relaxation technique or some breathing technique as well. It is very important to listen to what she wants and help her to communicate with the medical professionals.
Yes, very important to listen, right?
Yeah.
Yes, 'cause it can be challenging during that time.
Yeah.
For sure. And what can women expect from their bodies during the birthing stages, for labor contractions and
Yeah, so first of all, they would experience labor contraction. It happens when the uterus contract and relax, which helps to push the baby out. So it usually happens regularly and it gets stronger and more frequent. So what they can do is to try and document the time and the length of the contraction, because people would often mistake it as the Braxton Hicks contraction, which happens more irregularly and it is less painful. Yeah, so at that time, it is painful, but you have to try and relax yourself. Try to imagine some good moments or try and do some breathing exercise to relax yourself. The second point would be cervix dilation. So the baby is ready to come out, so the vagina will open up. So the third point would be the water breaking. So the sac of amniotic fluid will just rush out. So it feels a bit like you've wet yourself. So it's definitely not something you would see in the film, like the big gush of water flush out.
not
So-
as much, right?
Yeah.
Okay.
So it is light yellow in color, and you can wear a sanitary napkin, and you would usually go into labor within 24 hours. Yeah.
Okay, wonderful. And I believe that Maritza had touched on this, but maybe Chrissy, you can elaborate more. Can birthing balls help? And if so, what's the best way to use them?
Mm-hmm. Yeah, like Maritza just mentioned, a birthing ball can actually help before, during, and after pregnancy. So what we can do is to try and sit on it. So we can rock the pelvis side to side, forward and back, which can mobilize our pelvic area and to try and ease our pain in a supported position. We can also do circular movements like clockwise and anti-clockwise. So for a more relaxed position, we can sit on the birth ball and try to lean against some firm surface, for example, like a wall or on a table, and the birthing partner can actually do some gentle massage on the back to try and ease the pain. So there are actually a lot of stuff that you can do with the birth ball. For example, after pregnancy, you can also do all sorts of like core strengthening work with it as well.
Okay, so many uses for them.
Mm.
Very good. Okay, and that takes us into our third topic, postnatal physio. So Maritza, we'll start with you. What can women expect after they've given birth, and what might they need for support during that time?
Right, so after they have given birth, some women will still have residual back pain or neck pain. So at that time, as a physical therapist, we can assess and then help them relieve their tightness of the muscles, maybe with acupuncture, maybe with massage, maybe with ultrasound or different modalities. Sometimes the pelvis might be misaligned, so at that time the physio can mobilize the pelvis, try to put it back in the right position, and then use a pelvic belt to hold the pelvis in the right position. Also, they might have incontinence after giving birth naturally. So as a physical therapist, I can assess the severity of the incontinence and prescribe exercises. So before prescribing exercises, we have to assess whether they actually know how to use the pelvic floor muscle. And in order to do that, I will use a machine, the biofeedback machine, to check on the strength of the pelvic floor, and then I will use an electric machine to help them strengthen the pelvic floor muscles. Then, once they learn how to strengthen or use the pelvic floor, then they can do it themselves at home. They might also have breastfeeding problems, such as, for example, they don't know how to latch. The baby don't know how to latch, or the posture, the position while breastfeeding. So education is very important. If the breast duct gets blocked, we can help them with massage and with therapeutic ultrasound. So.
Very good. And okay, and maybe you can shed some insight as well as what's the best way to hold a baby safely.
So most moms, newborn, new moms, they usually hold their baby and carry them through their armpits, so they will actually hold them this way. When you do that repetitively, maybe 100 times a day, you might end up with wrist pain on both sides. So in order to prevent that, it's actually better to scoop under their bum and use your forearm, and then hold their back for support or for balance. Instead of holding it this way, you can use your forearm and just use your other arm for support. That way you can minimize wrist pain.
Okay, and some moms, we touched on this already as well, struggle with lactation. Mm-hmm. Maybe Christy, you can just address this a little bit more.
Mm-hmm. Okay, so first of all, maybe find a comfortable position for both yourself and the baby. So try and use a pillow to support your back, or just put a pillow underneath your arm to support your arms, because better positioning can actually lead to better latching and more effective breastfeeding. And then you can actually always try different positions and see what works the best for you and your baby. Okay, so breast engorgement happens when your body produces more breast milk, more than your baby consumes. So it sometimes can actually block the milk duct, and it can actually lead to mastitis. So on our side, physio can help with therapeutic ultrasound or manual therapy to try and ease and clear away the blocked ducts to try and facilitate the breastfeeding journey.
Yeah, great, thank you. Okay, and what kind of exercises or physio is best for new moms after they've just given birth?
Mm-hmm. So it is always good to start with some diaphragmatic breathing, so deep breathing exercise, and also pelvic floor exercise straight after you've given birth. Gentle exercises like brisk walking can actually help as well, because it puts less stress on the joint, which is already lax. Mm-hmm. And then modified Pilates and gentle yoga can actually help within the first few, a good start to within the first few weeks. Yeah.
Okay, initially, right?
Yeah.
Great. Okay. So just a more generalized question, why is it important for new moms not to just focus on their baby but themselves as well? Because I know this is often said to new moms, but if you could just elaborate as to why that is so important.
Yeah. So most of the time, new moms forget about themselves. They put their baby first and then themselves last. And actually, that's not correct. You should actually put yourself first, because if you're not healthy, if you're not feeling well, you won't be able to take care of your baby. So actually, it's very important to sleep as much as you can, because the lack of sleep will actually make you unable to produce as much breast milk. Besides sleeping, I think taking care of your body is very important. So if you haven't seen any medical professional to assess your condition, because first of all, you need to know what's wrong, and then second, then you can try to treat that area. So if you could see somebody such as a physical therapist to assess what's wrong, maybe it's abdominal separation that's causing the problem, maybe it's pelvis misalignment that's causing the problem, or maybe it's just simple neck and back muscle tightness that's causing the problem, then you should try to get that assessed and get that treated as soon as possible. Besides that, I think strengthening women's health specialists to do reformer Pilates, it will definitely help with the core strengthening, with neck and back problem, and pelvis misalignment problems. So I think by just doing reformer Pilates, it can actually target most of postpartum problems.
Great. Okay, and how can physio and exercise routines evolve after the newborn? So as the baby's starting to grow, what exercises should moms be looking at?
So as the baby starts to grow, the baby starts putting on a bit more weight, becoming heavier and bigger and taller. Some moms actually think of using the baby as weight to exercise, but I would recommend not to, because the baby is usually much heavier than you can actually lift 10 times in 3 sets. So because the baby is also quite unstable and it's moving, so you might injure yourself while using the baby as a weight. So I think I will highly recommend using dumbbells instead, or elastic band and birthing balls. So those are better, because with dumbbells you can choose the weight, 1 kilo, 2 kilo, 5 kilo, and you can progress from then. With elastic band, you can choose different colors. Different colors have different strength, so then you can progress yourself accordingly, and you can do 3 sets of 10. And with the birthing ball, they also have different sizes. So I think that's the best way and the safest way to strengthen yourself.
So start out slow and stable and low weights, right?
That's right.
Okay. And we are in this beautiful new facility, which I hear has only been open for 2 months. So maybe, Christy, you can let us know a little bit more about what's going on here.
Yeah, so our center is located on the 19th floor in Wellington Street. So we have a fully equipped gym area and also a Pilates reformer to help with women's with different women's health related condition. So we have different equipments which can cater the need of the diagnosis and also the treatment of different women's health related conditions. So come find us if you need any help.
Very nice. It's lovely in here. Do we have any other questions from anyone viewing right now? No? Okay, ladies, would you like to add anything from what you've already said? No, we've covered it all?
Yeah,
okay.
we've covered it all.
Thank you both for joining us here today and sharing your insights. And yes, I think that anyone, whether they're thinking about getting pregnant, are pregnant, or in the afterbirth stages, pulled something away today. So thank you so much. It's been great. If you would like to book a consultation with Prohealth Sports and Spinal Physiotherapy Centers, you can head to sportsandspinal.hk, and they are offering a promotion right now for our viewers, 20% off the first women's health physio session for new patients if you quote Little Steps when making your booking. If you would like to watch more videos like these, you can subscribe to our YouTube channel. You can follow us on our many social media platforms, or better yet, you can subscribe to our weekly newsletter. And we do go live every week. You can check out our Facebook page for the next upcoming event. Until next time, bye for now. Thank you.
Bye.